Hi, class. It's Dr. Lindner. I'm just going to add a little bit more information to connective tissue. I know I have another video on it, but here's some additional information that I'd like to share with you. So just as a basic review, the connective tissue consists of two basic elements. There are cells, and there's ECM or extracellular matrix. The If you think of epithelium, remember, is a bunch of cells closely packed together with very little extracellular matrix. Here we have cells scattered apart with lots of extracellular matrix. Connective tissue is highly vascular, good blood supply, and an excellent nerve supply, with the exception of tendons and cartilage. So tendons and cartilage gets a lot of its nutrition not from blood. It's going to be getting it from synovial fluid. That's why movement of joints is very important. When you move and circulate your joints, whether it's your shoulder, your elbows, your hips, you're moving synovial fluid, and synovial fluid is going to nourish the cartilage cells. If cartilage cells don't get their nourishment, they don't regenerate and rebuild. They degenerate and break down. And that's what DJD is, degenerative joint disease, aka osteoarthritis. Now, tendons also, they don't have the best blood supply. Neither do ligaments, right? When you stretch a tendon beyond its anatomical limits, we call it a strain. But when you stretch muscles or tendons beyond their anatomical limit, we call it a strain. But when you stretch ligaments beyond their anatomical limit, we call it a sprain with a P. Ligaments are soft tissue that go from bone to bone, whereas tendons are the attachment of a muscle to a bone. So how do muscles attach to bones? By way of tendons. How do bones attach to bones? By way of ligaments. Both don't have the best blood supply. Of the two, muscles are certainly better. Ligaments, not so good. Cartilage, not so good. Tendons, some okay, some not so okay. All right, so the difference between strains and sprains: strains involves muscles and tendons, sprains involve ligaments. Okay, so again, just to review, most connective tissue is vascular, except for ligaments, except for cartilage, and some tendons. The functions: there's the structural framework of connective tissue. That's bones, muscles, tendons, ligaments. There's liquid connective tissue. We have the important function of transporting fluids and dissolved materials through the body. So we need blood in order to do that. Connective tissue also protects our organs, so we have fat and adipose to do that. There's energy storage. Again, fat stores lots of energy, triglycerides, lots of energy, and it defends our body from the invading microorganisms. Again, blood, but this time not red blood or red blood cells, but the white blood cells. They produce antibodies. When we think of connective tissue, I think of these three components: cells and extracellular matrix and ground substance. So when we think of the extracellular matrix, it's these proteins, these extracellular proteins, whether it's collagen fibers, elastic fibers, reticular fibers. So we have these extracellular proteins, and we have ground substance. So together, the proteins and the ground substance, the different texture to those ground substance, makes the extracellular matrix. So what helps to determine the consistency of the matrix: sometimes they're fluid, sometimes they're gel-like, and sometimes they're solid. So we have high hyaluron or high hyaluronic acid. That's a little bit thicker and more viscous and slippery. We have chondroitin sulfate, which is a little bit more jelly-like. And then we have adhesion proteins that binds collagen fibers to the ground substance to make it more solid. When people have arthritis or degenerative joint disease, Many times you'll hear of people using glucosamine chondroitin sulfate, glucosamine chondroitin sulfate. So this is where you have the chondroitin, the sulfate. Some people use high hyaluronic acid to help nourish their joints. Again, it takes a long time to get that into the cartilage because it's not using blood supply. It's got to diffuse from blood into the synovial fluid, from the blood into the muscles, into the tendons, into the adjacent cartilage, and it does take a little bit of time. The first type of connective tissue that appears in the embryo is called mesenchyme. It has stem cells, and these mesenchymal stem cells kind of give rise to other connective tissue. We have cells that are called blast cells, like fibroblasts or chondroblasts or osteoblasts. So these are very abundant, and they are one of the permanent residents that we find in connective tissue. They're always present. They secrete hyaluron, and that's kind of like the cement that helps to hold epithelial cells together. We have cyte type of cells. These are like chondrocytes or osteocytes, and these are more mature cells. Unlike the blast cells are immature and they can produce matrix, whereas the cyte cells, these are mature, they cannot divide and they cannot produce matrix. Macrophages, these macrophages develop from monocytes. Monocytes become macrophages. Monocytes are in circulation. It's a white blood cell. And when it finds debris or infection or anything that it's trying to get rid of, it dives into that tissue. Now it becomes a macrophage, which is phagocytic. It engulfs bacteria or any type of debris through a process called phagocytosis. Plasma cells, these develop from B lymphocytes. And these plasma cells produce antibodies, and antibodies will attack antigens. Okay, antibodies will attack antigens. Mast cells. Mast cell is another type of white blood cell. It produces heparin, histamine. These are involved in dilating blood vessels and making them nice and thin blood, so that when tissues become damaged, if you have a dilated blood vessel and blood can travel through there in a nice, thin, easy way, you can bring nourishment and oxygen and glucose to the damaged area to allow it to heal. So heparin and histamine are very, very important in dilating the blood and making it nice and thin. Adipose cells, adipocytes, these are involved in storage of fat. And again, remember the permanent residents are fibroblasts, fat cells or adipocytes, and mesenchymal cells. These are all permanent residents. Now, if you look at connective tissue and just look at some of the different cells that we have mast cells. Again, these are important in dilating blood vessels and making them nice and thin during an inflammatory response. Plasma cells are going to make antibodies. We have neutrophils. These are white blood cells that, when they're in high amounts, typically means that there's some sort of bacterial infection. When neutrophils are high, there's some sort of bacterial infection. When eosinophils are high, it means there's some sort of some sort of allergy. Here we have macrophages. Again, these are derived from monocytes. Monocytes become macrophages. There's different types of macrophages. When you have a macrophage in the neural system, it's called a microglial cell. When it's in the liver, it's called a Kupffer cell. When it's in the lungs, it's called the alveolar dust cell. So they just change names depending on the tissues that they're found. Then we have different types of fibers, like collagen fibers. These are kind of strong. We have elastic fibers. These allow for elasticity and flexibility. We have reticular fibers, again, for support of other organs within the human body. So all these different types of cells and different types of fibers, along with the ground substance, all make up connective tissue. But you can see it's a bunch of cells. They're not closely packed together. They're far apart with lots of extracellular matrix, ground substance, fibers, all intermixed together. Now, the ECM is really important. It's composed of the fibers and the ground substance, and we want to keep the ECM, or the extracellular matrix, healthy. It's what binds us together. A healthy extracellular matrix means a healthy body. When it's damaged, we have a problem. If you have healthy ECM, it's going to mean reduced pain, reduced degeneration, and good healthy function. When you have unhealthy ECM, this is what happens from chronic or soft tissue injury. Someone hurts their shoulder and it's painful for 4 or 5 weeks. That's okay, that's acute. But when a patient comes in and they go, oh, my shoulder hurts or my neck hurts, and I go, how long has this been a problem? They talk about years. That's a major, major issue, because damaged extracellular matrix will create degeneration to all the adjacent other structures within that area. So it can happen from a routine soft tissue injury, damage to the ECM, or repetitive injuries over and over and over again. It can happen with people that have poor posture, because good alignment is important. But if your alignment is off, all of your ligaments and tendons and muscles are being stretched. And when things are being stretched, we have a problem. Okay. That will involve degradation or a breakdown of different connective tissues. So the whole idea is there a way of down-regulating the expression of these collagen damaging enzymes? So MMPs, which stands for matrix metalloproteinases. If you look at the word matrix, like extracellular matrix, metalloproteinases, anything that ends in ACE is an enzyme that breaks things down. So MMPs, matrix metalloproteinases, they used to be referred to as collagenases. So anything with collagen or protein is going to be broken down when the extracellular matrix is being attacked. So can we down-regulate or turn down the volume on these MMPs, these matrix metalloproteinases? So when we think of connective tissue, we think of ECM, extracellular matrix. They're found in tendons, joints, ligaments, cartilage, and fascia. So when your ECM is damaged, all these things can degrade and break down. The extracellular matrix is the scaffolding. It is the scaffolding that's holding us together. It's the scaffolding for all the cells. And remember, there's non-cellular components and cellular components. Chondroitin sulfate, hyaluronic acid, collagen, these fibers. These are non-cellular, but fibroblasts, chondroblasts, osteoblasts, chondrocytes. These are all part of the cellular components. So the ECM has multiple purposes. It provides adhesion for holding things together. It's the scaffolding, again, holding things together. It's involved in signaling from one cell to the other, the intracellular signaling. And it's involved in translating the mechanical loading into different cellular responses. So when a tissue gets damaged, the body releases prostaglandins, thromboxanes from cells, and these are involved in signaling pain and inflammation. The chondrocyte in the extracellular matrix is going to release MMP. So the chondrocyte, that is the cell that releases these matrix metalloproteinases, aka collagenases or proteinases, and they're going to break down anything with collagen, elastin. It's going to destroy everything. Now think of collagen is in skin, it's in your muscles, it's in tendons, it's in joints, it's in blood vessels. So there's different types of MMPs. There's MMP1 and MMP13, and these are collagenolytic Lytic or lysis means to break down collagen. These are mostly associated with cartilage breakdown, right? Collagenylysis, MMP1 and MMP13. The chondrocytes are stimulated to secrete these high levels of matrix metalloproteinases. And once they're stimulated or activated, they mediate proteolysis, right? To break down things with protein, which are found in tendon, bones, cartilage, blood vessels, skin. So look at this. So here's MMP13s. Here's the chondrocyte. These are collagen proteins or collagen fibers. And a large part of your bone is made up of collagen. Okay, so these MMPs are released from the chondrocyte in response to some sort of injury or inflammation. And then what happens is it just starts to further break down the collagen tissue during inflammation. Here's the MMP1 and MMP2s that are just breaking it down. And this is what you want in the short term. We want to break down and then build up. But when it breaks down and breaks down and breaks down and it never builds up, that's when we have a problem. That's where the acute neck pain that's 4 years old starts to create degenerative joint disease, or the injured rotator cuff starts to create injury to other muscles as well as the joint itself. So the key is, can we modulate the expression? Can we turn down the volume of these MMPs to support healthy remodeling? So when the MMPs are not modulated properly, you get things like repetitive injuries. You get fractures that happen. Like I've seen many students that are walking around with a boot around their ankle, and we go, "What happened?" They go, "I broke my metatarsal." "Well, what were you doing?" "Nothing. I was just walking." This is because they have MMPs circulating around. Poor wound repair, degenerative discs, right? Not just one disc. If you have one disc degeneration, that could be mechanical from an injury. But when we see things like L2, L3, L4, L5 disc, or C4, 5, and 6 disc, these are signs of inflammation. And periodontal disease. A healthy mouth equals a healthy body. Diseased mouth is a diseased body. The teeth and the gums tell you a lot about an individual. This is the work of a dentist, Weston Price, that traveled around the world and made this connection between the health of the mouth and the health of the body. Anyone that has a cat or a dog, they'll tell you the same thing, that the veterinarian will say, healthy mouth, healthy dog. Healthy mouth, healthy animal. Same thing is true with humans. So the MMPs, the matrix metalloproteinase inhibitors, may play a supportive role in the treatment of tendinopathies or tendon issues and modulate the degradation of the ECM. So what can be used? What do we know about? Hops, berberine, these are some bitter herbs. We know hops is in beer. That's why people, when they drink a beer, sometimes feel their musculoskeletal system feels better. Now, I don't mean drinking a whole keg of beer. We mean using the hops in it to help modulate inflammation. Selenium, that can address MMP1 and MMP2, where hops and berberine affect MMP13. Folic acid can affect MMP9. MMP9s tend to break down blood vessels. So just kind of give you an idea of the big scope to why we're learning about connective tissue, and when it becomes damaged, and we learned about epithelial tissue when it becomes damaged, the intestinal permeability. There's always ways in healthcare to modulate things. Besides using pharmaceuticals that could be quite harmful to people, there are things found in nature that the liver and the gut and the intestines can recognize that are not destructive. We spoke about the fibers, collagen fibers, elastic fibers, and reticular fibers. Collagen fibers, this makes up like 25% of the protein in the body, tendons and ligaments. They're tough, they're resistant to pull, but yet there's a degree of pliability. And they're formed from protein that are called collagen. Now, elastin sounds like a rubber band that has elasticity. We find them in lungs, the blood vessels, cartilage in the ear. So Elastin is very important. Many ligaments have elastin. Ligaments where we need a little bit, not so much strength, but perhaps more flexibility, like along the spine. Spinal ligaments have more elastin because the spine is pretty stable. Unlike the knee joint, very unstable joint, we need more collagen there, not as much elastin. Um, Elastin is found in um, in blood vessels, in the lungs, in the cartilage. It can stretch up to 150% of the relaxed length and return to its original shape. And this is one of the problems with diabetics, especially with blood vessels, especially with soft tissue and ligaments, is the inability or the destruction of some of this elastin. And reticular fibers that are found in the spleen, the lymph nodes, the liver, these are thin branched fibers that form the framework of organs. Reticular fibers are designed to stabilize organs, blood vessels, nerves, despite gravity. Okay, you can look at the blood vessels on the back of your hand, shake them and move them around, and those blood vessels still remain where they are. That's due to these reticular fibers. Your organs are held in place due to the reticular fibers, despite gravity that may want to move them down. They're similar to collagen, but they're arranged very differently. They're not aligned in parallel forms. There is an inherited disorder when we talk about connective tissue. One's called Marfan Syndrome. This is an inherited disorder of the fibrillin gene. This is when there's abnormal development of this elastic fiber. This is when people grow very, very tall. Their limbs are very long and slanky, long legs, long arms, fingers, and toes. And it could be life-threatening. There's weakening of the aorta or the blood vessels. And when they become weak, it could be life-threatening due to rupturing or an aneurysm. It's not the long bones that become the life-threatening part. It's the weakening of the blood vessels, and should they have an aneurysm.